Today the Chancellor announced her budget, her second of the year, and coming only several months after the spending review. It was light on health policy announcements, having seen quite a big increase in the NHS budget back in June. But there are two things that's important for health leaders to know. Firstly, the government has confirmed plans set out in the 10-year health plan and the 10-year infrastructure plan to roll out 250 new neighbourhood health centres throughout the country. The government expects, perhaps ambitiously, 130 of these to be ready by the end of the decade. What's more important perhaps is that this will be largely funded by a new public-private partnership model, the details of which are still to come. At the Confed, we've been calling now for a number of years for a loosening of the rules around private investment to try and get in a massive amount of new capital, given the state that the NHS is in. We know that there have been very important lessons to have been learnt from the private finance initiatives in particular, but we think if those lessons are learnt, we can kind of have a new and sustainable way of bringing in private finance. Like I said, some more details are to come yet, but we will be working very closely with the government to try and make sure that it works best for members. The second big announcement was a completely new £300 million for tech capital investment. So this is actually new money that's come from June, which is quite rare, and it will go towards a number of kind of IT projects that the government have planned. Some of the more tangential announcements include changes to the rules for salary sacrifice. Now, while that shouldn't affect the NHS pension scheme itself, we do anticipate that affecting some of the third-party suppliers for the NHS, but that won't come for a number of years yet. Interestingly, the Office for Budget Responsibility changed their inflation forecasts as well. Now, it's not uncommon for that to happen as the real world unfolds, but what it does mean is the 2.7% real terms increase that the Chancellor said would happen in June is now only a 2.4% increase over that 3-year spending review period. So we'll be looking very closely to understand what that means for members. There was also the confirmation that the government will be bringing forward some aspects of NHS England's budget from 3 years till next year, and that's to help pay for the various redundancies at both NHS England, ICBs and other ALBs as well. So a relatively light budget this autumn, but we'll be working very closely over the coming months to see what impact some of these announcements have for health leaders ahead of the spring budget.